and spent after doing that, I spent 4 years in medical school and 3 years becoming an internal medicine physician. But then starting in 1980, I started working in infectious diseases for 3 years as a trainee, and then for the past 37 years as a faculty member at the University of New Mexico. I'm currently parked in the Center for Global Health at UNM, so I guess that's an appropriate place to be working in the face of the current pandemic. The things that I've experienced in my lifetime with regard to epidemics or pandemics, I guess the first big deal was HIV/AIDS. I was, as a junior faculty member at UNM, starting in 1983, or excuse me, 1983 to 85, 86, we dealt with the first cases of AIDS in New Mexico, and I was involved with setting up an HIV/AIDS clinic, worked on a governor's AIDS task force where we dealt with essentially disaster planning issues around HIV, AIDS, and that was my first experience of working closely with the health department at the state of New Mexico. Then in 1993, New Mexico was what we call an epicenter for hantavirus disease. And the disease, it's been here for tens of thousands of years, but it was first recognized in 1993. And most of the first cases were in New Mexico, Arizona, southern Colorado. A lot of them came to our hospital. Actually, our hospital still has the greatest experience in dealing with hantavirus disease in the United States. And then I subsequently began about a 20-year research study in Chile, where they have an equally severe form of hantavirus disease that's also transmitted person to person. So that's kind of where I come from.
Quick question for you, Doctor. Were you involved inside of the Anthrax Scare and all that stuff from 9/11 as well?
Absolutely. And so after the Anthrax Scare, I was one of a group of about 50 physicians or PhD investigators who were invited by Tony Fauci, who you've seen on the news a lot recently, to go to the NIH. And we had a 2-day meeting talking about responses to bioterrorism, and some of the planning for bioterrorism and pandemic response came out of that, I would say meetings like that.
So this isn't like, you're not new to dealing with everything from infectious disease to different types of pandemics and epidemics. This isn't something that you're new to. Have you ever seen anything like this before in the history of you, like where they're shutting down schools and they're all of this jazz?
Now, honestly, I think you have to go back to the influenza pandemic of 1918, 1919. And it's for something like this. So
we're literally kind of making history here.
We are. So now it's more than a century later, we're now faced with a pandemic. And that pandemic it's estimated that it killed about 1% of the world's population. So if this one's anything like that, depending how you look at it, 1% say, oh well, we're living in the United States. There are 340 million people there. That's 1% of the population would only be, so many millions of people, but that's a lot of people.
So I think one of the things that I was annoyed with when this came out is everybody, coronavirus. Freaking nobody knew anything about it, and they didn't educate people properly on it. They didn't talk about any of the symptoms. They didn't talk about any ways to counter it. They didn't talk about any ways to handle it. And that's obnoxious, right? Like, I mean, how do you keep something from happening if you don't have the information? So what are some of the signs, or what are some of the, because I know that there's certain people now that they're saying, hey, they have this coronavirus, but there's no symptoms. They're symptomless. They don't show anything. They're not, so what are some of the symptoms of the coronavirus, and what can people do to keep themselves safe? And go ahead.
Sure thing. So symptoms, I think you can. Boy, I think if you're like me, you and the other people involved in this are overwhelmed with warnings about what the symptoms are. But it's primarily the more severe disease, fever, cough. Those that have fever and cough, and then develop shortness of breath, are at risk of being the roughly 20% of clinically diagnosed patients that need to go to the hospital. So if you get sick, if you feel sick, you got about a 20% or one chance in 5 of being so sick you have to go to the hospital. And then a quarter of those people are really sick and need to be in an intensive care unit. And that's the population at risk of dying.
And that's a respiratory?
Yeah, it's a respiratory death. It's caused by something called acute respiratory distress syndrome. There are a lot of different infections and diseases that sort of can funnel you into that syndrome. But if you develop that syndrome, you're talking about a couple of weeks on a ventilator if you survive. So it's a very serious thing.
Is this attacking one group of people more than another group of people?
Absolutely. Older people like me, and people with underlying disease. People with uncontrolled diabetes, people with underlying respiratory disorders. If you have serious, and I'm not talking really, probably not about like the general population that has or has had asthma, but people with more serious underlying lung disease like chronic obstructive pulmonary disease, COPD, the kind of this pulmonary disease that leads to fibrosis and restriction of lung function. Those individuals are at very high risk. And
where did it come from?
Well,
what are the thoughts of where it came from, I should ask?
Okay. So, I mean, these are the coronaviruses. One is that they're fairly recent. So the hantaviruses I've worked with for the last 25 years are ancient. They've been in the New World for at least 25,000 years. They came over the Bering Strait with rodents 25,000 years ago. But the coronaviruses have only been around for about 500 years. And we've known about coronaviruses causing the common cold. There are 4 of them. We've known about those for some time, but there's been no experience with serious life-threatening coronaviruses prior to 2003 when SARS developed. And SARS, fortunately, the spread was limited after about a year, and it's died out. There's no more SARS anymore. The 10% of people, though, that got it died. And then about 10 years ago, a Middle Eastern respiratory virus emerged, also a coronavirus. That one has a higher risk of dying. About 1 in 3 people with that will die. But fortunately, that has not spread in epidemic or pandemic levels. So it's been largely limited to the Middle East. And then there have been some outbreaks of travelers from the Middle East that have been extinguished. So that has not developed into a pandemic. So,
and where did you say it originated from? Where do you think it?
Oh,
what are the thoughts on that?
So this one from bats. I think it's from all of them are probably related, originating in bats, and then these bat viruses can infect they can infect different animal hosts. And so right now we have 7 that infect humans. They're coronaviruses that infect other animals. So those, but I was going to say that coronaviruses as a group have only been around for 500 years, which is pretty recent. And then these life-threatening coronaviruses in humans, less than 20 years.
Mm. And so how did this come about? Was somebody licking a bat? Were they like dancing with it? What were they doing? Eating it?
We don't know. I don't think we know, but I think the original, it's genetically, it's linked to viruses that had already been known to be present in bats, and it's closer, although there's some concern about animals, maybe, and it could be that bats infected an animal that was then present in that market in Wuhan, China, and that people acquired it that way. But there also reportedly were bats there, and there are a lot of ways that bats can come into contact
With human beings.
What's that?
With human beings, right?
Beings, yeah. I mentioned this is not a coronavirus, but there's a virus, the Nipah, it's called Nipah virus. It's also an RNA virus. It's not a coronavirus, but it's interesting. Nipah virus causes brain disease, brain infection in humans, and it's present in a number of countries in Asia, but including Bangladesh and India. And there, the fruit bats will land on trees where people are collecting palm sap, and they're going to use the palm sap. I think they can make liquor from it and various things. But it's like putting something into the side of a maple tree and collecting the maple sap. So the bats come along, and there's this thing sticking out of the tree, and it's dripping into a bucket, and it's thought that the bats will then lick the sap coming in there and then urinate or defecate into the bucket, and then
disgusting.
Yeah, and people without coming into direct contacts with the bat are infected through their excrement by ingesting that. So who knows on this one? It may have been directly from bats. It may have come through another animal that went through that market. But what seems to be clear is that by looking at its current genetic diversity, we can trace back to when it emerged from bats.
Mm-hmm.
And I don't know how to do that, but this can be done through calculations looking at how much the virus has mutated over time, and it all goes back to a time like in November of last year. So this virus has not been circulating for decades, like with Hanavirus in '93. It had been here for as long as people have been here. We just didn't. It was rare enough. We just didn't recognize it. This is true. This is truly a new virus.
So you've experienced a lot of these different, like we said, pandemics and epidemics, and now all of a sudden they're shutting down schools. You know, my daughter's home from school for 3 weeks. You know, today the governor got on and did this media press release and said all gyms have to close down. So we're setting something up special for our students where we're going to be able to, our private students, it's one-on-one. I think that's small enough, and we're planning on still working with our individual students unless we see something that is regulated otherwise. We still have to kind of see the details of how that's written. But for the group classes, we're going to have to cancel the group classes until we hear from them on what they're going to do. And we've got some methodologies for those of you who are clients that are watching on how we can handle that and how we can counter it. But one of the things that I want to talk about is, do you think that they're overreacting? Is this a just way of behaving? And maybe that's a question that you don't want to go into and answer, but I'd like to actually throw it out there because, you know, you go down to the shelves. I mean, this is a respiratory disease and you can't find any toilet paper. You got these people going out there creating issues, and people's lack of preparation throughout the year, and also their excitement and confusion and scaredness. They're overreacting, which I think is really causing more of a problem than the pandemic itself.
Well, it's hard to say. I mean, I guess what we'll know based on experience in different countries and different states, I guess in 6 months or a year, we'll know who overreacted and who didn't. And so
It's fair.
Yeah, in my opinion, probably, I don't know who.
It's hard to. I think one of our
it's worth here. Let me say, so it's respiratory, but it's also droplets. So there's information. Everybody's taught, like, when you, in order to keep from getting the common cold, which is transmitted by droplets, you're taught to wash your hands, and part of that's because the droplets go onto surfaces, and it can live various periods of time on surfaces. And there's some data coming out with this virus on how long can it last on plastic versus paper and metal and so forth. So, you're talking with this one, you're talking about hours or days. The amount of virus is decreasing over that period of time, probably decreasing pretty rapidly in the first couple hours. It doesn't do well in sunlight, but in certain circumstances, it could be present for days. So
if somebody goes to a park and they do some pull-ups on the bar, and if for some reason lick their hands, right, they could obviously get it from somebody who had come up and coughed on that bar, or coughed in their hand and touched the bar or whatever. So
possible, if it's bright sunlight here in New Mexico, if we get some nice hot sunny days, and that bar is hot when you touch it, boy, I wouldn't worry so much about it. But yeah, that's theoretically a possibility. The other issue is that you don't have to have symptoms to transmit it, and there's just the modeling so far from China suggests that most people acquired it from someone who had not been diagnosed, just from going from community contact with someone else in their community who had not been told that they had coronavirus. So it's hard to just, I don't think you can go through the grocery store or whatever and just look at people and say, well, if they're not coughing, I don't have to worry. I mean,
yeah, okay.
The other thing I talked before, 80% of people are going to have very mild disease. And I think if you watch on television now, the celebrities that are being interviewed from home by Skype, who've already been diagnosed, and gosh, they look pretty good. I wouldn't be able to look at that person and
know that something's wrong.
Know that something's wrong. No, there's no way. So that's part of the concern.
One of our viewers has a question, and I want to ask it directly to you. They said, can you tell us why and how serious this is? So why is it serious? And I think we know that just from the fact that the elderly people can die from it, and the older people or people who already have some kind of immunity issue. Right. But how serious is this right now? And do you know how many people have died from it already?
It is. I don't have those numbers in front of me. Probably the best place to go for that, Johns Hopkins has a site where they look at the Johns Hopkins School of Public Health. I don't have the site in front of me, but you can. A lot of the news, like CNBC, and CNN or MSNBC or Fox, I think will have. They're going to be showing those figures.
Okay.
They're going to be showing images from that site, and it's an open site, so you can go there and look at it, and it's updated throughout the day, every day. The problem is that when you say in a community, when you see the first death, that's, you're thinking, well, 1% of people die. Well, that means that's at least probably 100 people already in that community have it, and that death, that person that's died has been infected for 2.5 weeks before they die. People don't just get it.
So for them to get it
over. So there's a lag between the time it's really transmitting in the humans or in the community and when you start to see the deaths. So
okay.
Yeah. So it's just because people don't die right away.
So another viewers, one person's mentioning that people are losing their jobs, and I see that, and this is, there's got to be a smarter way that they approach this, because from a economic standpoint, this is obviously going to be catastrophe. This is a catastrophe, right? You can't just take a whole bunch of people and say, freaking go home, right? And we'll see you guys in 3 weeks, because then they can't pay their bills and they can't do their stuff. And the electric company doesn't freaking care. They're not going to they're not going to be like, you don't have to pay your electricity for 3 weeks, right? So
I actually heard that P&M was not going to be shutting off service for people that were behind on their bills, which
Oh,
is,
how generous of them! But I'm sure they're going to charge them for the next 3 weeks, even though they don't have a job for the next 3 weeks.
I don't have stock in P&M. I pay them.
So we got another viewer who has a question. He said, generally speaking, how long does the infection last inside the body? And then after infection has occurred, how long is it contagious?
So I can't answer that exact, but some of these, the people are sick for a couple of weeks, 2 to 3 weeks, and it's probably, if you look at these people that are still in quarantine, like the people that can't, probably the best data now, I guess, is probably coming out of the people that were on the cruise ships who are in actual quarantine, because most people are just being told, or that have it. If I went in today and got tested and they called me and told me my test was positive, they would tell me, stay at home unless you can't breathe, then call 911, right? So that's what they're going to tell me. So, but those people in quarantine are being checked, and they're not being allowed to leave until they have a series of negative PCR tests, which is PCR is a way to directly detect the virus, the viral RNA in swabs from the respiratory tract. So some of those people have their symptoms have resolved and they're being kept for another couple of weeks waiting for their tests to go negative. Now, whether they're, I haven't seen data on how much virus is there. It's kind of like that situation with the inanimate surface. So like plastic or maybe copper or steel, virus can probably be detected there for 3 days, right? Maybe longer. I have something I'd have to look. But so let's say it's there for a couple of days. Well, at 3 days, the amount of virus that's there, they already know is much smaller.
Right.
That first day. Now, is that enough to really infect someone? I don't know. But this is information that's emerging. Hopefully it's going to get the certainty around the science will get stronger. But I can tell you this, I'm getting stuff every day.
It's new stuff.
Yeah, new stuff every day.
I think that's part of the problem, right? Is that we see these people that, we just see these actions being taken, and it sounds like you're a subject matter expert in this stuff, and it sounds like you're still getting new stuff each day saying, hey, here's what's going on. And you're like, what the freak? Right. So, the general population.
But so are the people making these decisions.
Yeah.
So, like I say, they will be judged eventually on whether they made the right decisions or the wrong decisions. But they're getting the same information, and they're
trying to do the best they can with the information that they have.
Right, and they're trying to make decisions based on. And I think in the United States, the people who've been thinking about this the longest, people like Tony Fauci at the NIH. The people in the respiratory viruses division at the CDC, and you can bet they're looking back at the 1918 Spanish flu and looking at 1% world population dies. Well, we got a lot more people in the world now.
Yeah,
there were, and the death rate, right now. Influenza deaths worldwide, I think, are around 400,000. I don't have any question in my mind that this will eclipse what we're seeing with influenza now. It's got to be much higher.
We have another question.
I'll mention one other thing while I'm thinking.
Yeah, go for it.
If you read about epidemics in the past, whether it's the Spanish flu of 1918, which it's called the Spanish flu because it was a neutral country, and they're the only ones. All the countries at war were suppressing the data on how much influenza there was. But since Spain was neutral, they were reporting their cases, so everyone called it the Spanish flu. But there's a long history of blaming diseases on other countries, other ethnic groups. So
don't be a moron. Right. I think it's the moral of the story. I think, and I want to get to this other user's question, but I want to also mention for people in the United States that are not used to traveling, I've been all over the world. I've traveled globally. I've been to Dubai, Abu Dhabi, Bahrain. I've been to Guatemala, Panajachel, and Antigua. I've been in Switzerland. I've been in, like, you name it, I've been there. People don't understand how privileged we are in the United States to have the food and everything on the shelves, because when you go to these other countries, you go, well, they ate a bat. Well, if he did eat a bat, it's probably because they're starving. There's 1 billion people in China, right? And they don't have necessarily the same type of setup that we have here. And that makes it very hard. So guys, if you start looking at this and you try, like he just said, being, racist or ignorant about it, like, hopefully somebody is still walking around to slap you for being a moron. So try to just do the best you can in a case like this. I want to ask this person's question. They said Italy and Spain are doing pretty bad right now. And do you think that we are have to excuse me, that we're in the same predicament and that we're only a couple of weeks behind them?
Depends. So actually, Master Johnson was talking, I don't know if it was in a class last Thursday, or I think last Thursday, you're talking about someone in a government agency that talked about mitigation.
Yeah.
So, and not about this, but I think they were talking about mitigation.
Yeah, risk mitigation.
Risk mitigation. So we're beyond the containment phase, and we're into what's called the risk mitigation phase. So the strategy is through these extraordinarily and really damaging restrictions that are being implemented, which are going to have catastrophic effects on people's lives, economy, businesses. I mean, it's just going to be catastrophic. The hope is that through mitigation, that you'll slow down the rate of transmission so that you mitigate the peak. And I think if you look at on the if you go to websites, you'll see like a massive peak like occurred in China and is occurring in Italy, and then you'll see what what's hoped to happen during the mitigation phase here, where you slow down the spread enough that you, instead of having everything happen over 2 or 3 months, you spread it out over 6 or 9 months, something like that. The problem with not mitigating and not slowing it down is that the peak is damaging to society if it goes above the point. And just think about the number of hospital beds. Even if we have the Army build us additional hospital beds, how many ventilators are there? So they're talking in Italy about, if you're above a certain age, you don't get put on a ventilator. You are just allowed to die. Well, right. That's what happens if mitigation isn't successful. You just overwhelm the healthcare system, and the things that you and I take for granted, which is that if we get really sick, we're going to be able to be in a hospital and we'll be in an ICU, and that ICU will be able to provide 21st century medical care with intensive care unit physicians, and we can be placed on a ventilator, so forth. If we don't mitigate, if we allow the peak to go too high, we overwhelm that. And then there are people making decisions, and
on who lives and who dies.
Yeah, some intensive care physician that I was mean to 15 years ago on rounds is going to look at you and say, "Okay, asshole." Me?
I remember you didn't give me an A when you were teaching me in my class. That sucks.
Yeah, plan B.
So one of the things that I think is also important is to talk about, when we talk about risk mitigation, I think one of the things that, and this is kind of more my area of expertise than yourself, but I think that you can help with this definitely, is what should people be doing and what are the areas that they should be doing to protect their families as far as a setup over the next 2 to 3 weeks. And I think one of the first things you guys should do is make sure that you are capable of staying in your home for at least 3 weeks. Having enough food. Those of you buying all the toilet paper, by the way, you're all idiots. Okay. Like, you going out and buying all of it is not helping anything. all that does is make somebody else have to like take a water hose to their rear end and run up and down the street with their cheeks spread so they got to air dry. So don't do that. Buy what you need for the 3 weeks and have enough food and non-perishable items so that you can nourish your family, keep yourself safe. And remember the common core medicines that you can buy for diarrhea and, bug bites, Benadryl, things like that you can actually go out and buy at Smith's or where's the place I went the other day that was actually doing pretty good still? I'll try and remember that grocery store. It was something Brooks, John Brooks. They still had a decent amount of supplies left, but don't raid everything because that's just going to create more panic. Obviously, you want to get communication that's really good with your neighbors, being able to talk to them. Be prepared for having extra water. Hand sanitizer is cool, but freaking you guys buying all that, you guys are in the same position as the toilet paper people. Just buy enough that you need. What's that?
Soap and water works great. So
soap and water, and then also have extra water to drink. If you guys can get some 5-gallon containers, that's phenomenal. I'm going to give a shout out to our buddies that are at Kagan Water. Those guys that have their filters, those are amazing filters, and you can fill up all of your water, or you can go to them and get clean water. Just don't go in there if you're sick or ill. So if from a standpoint of what else to do to keep yourself safe healthily from this, what else should they be doing, Dr.
Well, the things that my daughter and I are doing is we're freezing some vegetables. We eat a lot of fresh vegetables and fruits, more so since my daughter moved back from college. I improved a lot, but so we're doing some freezing, and not out of not for 6 months or a year, but like you say, for a couple of weeks. And when there are we're trying not to hoard, and because you have to think of the community and that other people need those things too. But rather than letting vegetables or go to waste, we're trying to freeze them and then freeze the ones that we can. And so that's one thing. I'm sure all of you everybody's had to see. I'm sure has seen the stuff on social distancing. 6 feet. The 6 feet comes from the how far the droplets can spread when you cough. So there's within the risk is highest within 3 feet, but out to 6 feet, really, it can droplets can spread out to 6 feet. Aerosol, I don't think you have to worry about aerosols. There's some diseases that if the aerosol is created, the aerosol can stay in a room and remain infectious for a prolonged period of time for the whole room. But with this disease, the only place we are worrying about that in the hospital is where we're doing procedures. So if someone's having a breathing tube put down and they're being suctioned while the breathing tube's being put in and they're being put on a ventilator, well, aerosols can be created during that kind of event. So hospitals, but that's really a hospital specific thing that we in the community doesn't apply.
What about these masks that you see some people wearing? One of our viewers just said, does an N95 mask work out in public? And I heard another report where they said, look, that's great for, the front, but obviously your sides stuff can still get in there. Are the masks necessary? Are they just in over exaggeration?
I would discourage that because, honestly, I think that hoarding N95 masks, they're really for N95 masks properly fitted, and you have to go through a proper fitting procedure to know whether the N95 mask is doing what it's supposed to do. So hospital staff working directly with patients are using N95 masks, but they have to they're trained and they know what size, how to use it and so forth. I think I would look at that as kind of a hoarding thing for being out in the community. You're using something that we should probably try to limit so that people working in healthcare who really need to have direct contact
And they need those masks and have them.
That people that need it can have it. You can imagine that more healthcare workers that are at home on 14-day furloughs, the worse shape you may be in when you show up with serious disease. So
we have a worker that's in the healthcare field that's asking, I'm on the front lines of this virus. If I get exposed, what steps should I take? Is it smart to go home if I have a wife and kids at home?
I think hopefully your organization is providing you with guidance on that. I think that's the institutions are addressing issues like that of who goes home, and I think they. So I would try to. I'm on the medical staff at a couple of hospitals, so I'm getting a lot of information from them.
I think what they're asking is what should they do? So if they get exposed to it, somebody coughs on them, they're like, I've got coronavirus, and you're like, oh, freaking great. What does he do then? Probably he shouldn't go home with the possible risk of infecting his family or her family. What should they do?
So I think it depends on your, so like at UNM, for example, they have classified people in tiers. So they're tier 1 people, tier 2, tier 3. If in general, so if you were in that situation and you could go home and you weren't in an essential situation, I think they would be recommending that you go home for 2 weeks. There are other situations, especially if you're in you're essential, that they might want to do something like testing. So I think again, it's really up to you to communication within your healthcare setting to decide what to do. I think if it's feasible, if you've been exposed to somebody with coronavirus and you can go home for 2 weeks, it would be you should do that. And I think
their concern is, are they going to affect their family or should they stay away from their family?
Well, I think that's a tough issue. It kind of depends on, one of the issues there would be who else is in the family. Do you have an 85-year-old grandmother living at home, or are the other people in the family young and healthy, where their risk of getting seriously ill would be low. So I think you kind of take that into consideration. I think that that I know that one of the things that I think I saw this today is I think it was in the governor's report. I think they're looking at one of the things they're thinking about. Now, I haven't seen anything from UNM or press, where I'm getting most of my information about family risk to families. But the governor today, in discussing limiting hotel occupancy to 50%, was also talking about providing hotel rooms for healthcare workers who were exposed, or I don't know if it was exposed or sick. I can't remember. So I'm going to claim lack of memory on that. But the issue there being if let's say they're exposed, high risk exposure, or even worse, they're sick, and going home would expose someone at home who's in a high risk category, that they're looking at putting you up in a hotel for 2 weeks. So I don't know.
Either way, if
I don't know what kind of hotel,
if one of our users
Central or wherever, but
they're like, enjoy your Motel 6.
Yeah.
So one of the users said, anybody with family, do not wear clothes that you work in, shower before going home, and make sure that you're well protected after seeing patients, and be scrupulous about disinfection.
Yeah, those things make sense. I was on call this weekend, and I was in the hospital making rounds. When I came home, I didn't wear those clothes at home. I didn't rewear them the next day. They went into the wash.
Pretty much immediately.
My daughter even had me spray my shoes with Lysol. So
one final, I'll take 3 more questions, guys. One person asked, can we estimate how long before the things get back to the normal in the city? I don't think that's something that Dr. Mertz can do, because he's not on the city council and he can't really estimate that. But I mean, we've said that if we slow this down to try and slow it down, it could take anywhere, would you say 6 to 9 months?
Yeah, I think that mitigation phase, could be long term. Whether you have to keep all these things in place during the mitigation phase, I think that's going to have to be sorted out. And I think probably, it's so overwhelmed that the leaders, people making these tough decisions, are so overwhelmed with this acute response that they're going to have to kind of digest this acute response before they start thinking in terms of months and months.
Okay. So, I want to point out a couple of quick things here. I think it's important one of the most important things that you guys can do is not overreact, not panic, not hoard. Buy what you need and be smart. Because remember, you live in a community, right? And our objective is not to go, I'm good and I'm the only guy that's good in my community. That's not going to work out well when you're the only guy that's good in your community and everybody else doesn't have what they need as well, right? That takes real quick for people to turn on you. So make sure that you're using your head on that. Try to take what you need, provide for your family, make sure that you're good to go for 3 to 4 weeks. And then, try to do what you can do to help the community. Do it in small steps each day. Go out and grab a couple of items, bring them back. Make sure that you have stuff that you need, baby formula, whatever, for those that are around. And look, if you run out of toilet paper is a fairly relative new concept. It hasn't always been around. You can do cloths, grab some kitty litter, worst case scenario, because that actually works great for cats and people. Go out and grab yourself some propane so you have alternative means of cooking. Thank God this is in the, mid-spring / end of winter, and we're not in a situation where you got to worry too much about heat. Communication is key. Whenever you're dealing with a scenario where you have people around you or, people that you need to communicate with, let them know what's going on and don't be shady about this stuff. If you think that something's wrong, I know they've set up several check stations around the state, mobile site units. And if you could talk a little bit about that, Doc, I'd appreciate it, because I think that that's a concern that people have as well. Like, how the freak do I know? There's obviously not a kit at Walgreens that I'm aware of that you can go grab. So if they want to get tested, what do they do and where are those testing sites?
Well, I think, so I don't want to try to provide too much detail here, because I think that the rules are changing quickly on that.
Okay.
There are definite limitations in supplies so that even if you look at something as simple as the little tube with viral transport media and the swab, there are issues with whether we will have enough of those and what it's going to look like. There are issues surrounding the reagents that go into the testing. So, like already, these testing sites, I know of people that have shown up. I think it's important to understand the rules of the test site before you go, and find out whether you need an appointment. I think if you're worried well and you're not having symptoms, there's a high risk you're going to show up at one of these drive-through test sites, and you'll sit in line for 2 or 3 hours, and they'll say, sorry, you get up there, they ask you about your history, and they're going to send you home. So I think you need to understand who they're going to test. The other thing is that they are, because of the problems with having enough tests and materials to do tests, they're prioritizing. So I know that, for example, right now, the way it is in Albuquerque is that right now, each hospital is asked to send in information with names of patients who are prioritized for testing, and they're testing them within 24 hours. People that are showing up at test sites are not going to be prioritized as high, and the current turnaround, barring something more bad happening, is about 72 hours. So
you could bog down the system by trying to just go and get checked.
Yeah.
So
if you're at home, spending your time at home, you're limiting your contact, you're not feeling sick. At this point, just being tested. I wish we had enough tests that we could test everybody, because we could, figure out how many people are ill and isolate those that are ill and try to stop the spread. But it's just not feasible with the amount of testing available right now.
Dr. Mertz, you've been awesome today. Thank you for getting on with us and answering the questions that you have. I look forward to seeing you on this Thursday's call. For those of you that are students of ours, we're going to be providing an online option for every single student that we have so that you guys can still continue your training during this time. And you guys will also be able to jump on to our live calls. Those of you that are either on our online training or in our actual academy, you guys will be able to jump onto our Thursday calls for mental toughness and the warrior mindset, which are pretty awesome. That's what Dr. Mertz was referring to earlier, was the risk mitigation part that we jump on. If stuff materializes that's new and we need to bring Dr. Mertz back, we definitely will do that. We're proud to have you here and glad to have you here. And I appreciate you taking time out of your day to kind of share this information with everybody. So, sir, you have a great one. Stay safe. Enjoy your frozen vegetables. And I look forward to seeing you as soon as I can. And that's going to be my main withdrawal, is punching people. That's going to be the hardest part for me. I'm like, I need you to be 6 feet away, but I really want to kick you, you know? So look forward to seeing you guys all soon. God bless you. Take care. Pray for our leaders. Keep them in your prayers and do the best that you can to help support the strength and structure of your communities. Don't act foolish, guys. You acting foolish will only make things worse. Stay in good communication. God bless you. And we'll talk with you all soon.